Hello everyone, welcome back to our channel, that is Health Bar. So in previous video we have discussed regarding the defibrillator. So now in this video we are going to show you about the AED machine. So as you know that AED is an automated external defibrillator. This is a full form of the AED. So if we talk about the AED, in roadside scenarios we are using the AED, but if we talk about the defab we are using in case of the hospital setting. So this is a major difference between the defab and the AED. The first difference is that is the defab we are using in case of in-hospital scenarios and AED we are using for the out-hospital scenarios. And second difference is that is defab is a manually operated device and this AED is an self-operated device. We have to follow the commands of AED and AED will gives you a command, and the thing is you have to follow the commands of the AED. So in foreign scenarios you will get AED in the roadside, but in Indian scenarios mainly you will not get AED in the roadside. So in AED here you can see that is there is a green button and here is the orange button. तो जो हमारे पास एक green button है, this is for the on and off button, and this orange button is basically for the shock button. And these are the pads of the AED. So these two are the adult pads, and these adult pads we are placing in the sternum and in the apex of the heart. So these two are the adult pads. Then second one are the pediatric pads. So these two are the pediatric pad, and these pads we have to place in the anterior aspect of the chest and in the posterior aspect of the back. The difference is why we are using the pediatric pads in the anterior and in the posterior aspect is because pediatrics are having a lesser surface area as compared to the adult. That's why the placement is different in adult as well as in the pediatric. So now I will teach you how to operate this AED device. So what we have to do is first we have to click on the green button. Then AED will gives you a command, that is apply the pads on the patient bare chest. Then we have to apply the pads on the patient chest area. Then after application of the pads, now there is a plug-in. So we have to plug in with the connector. Then AED will gives you a command, that is analyzing heart rhythm. Rhythm is analyzed, shock required. Then deliver the shock now. Charging, stay away from the patient, and press the orange button for the shock. Then we have to press the orange button and then shock will be delivered and we can resume with the CPR. So now I am going to show you how to apply the AED pads. So first we have to click on the on button.
Apply pad to patient's bare chest. Plug in pad connector next to flashing light. Apply pad, plug in connector. Analyzing heart rhythm. Do not touch the patient.
Stay away from the patient.
Shock advised.
Now shock is advised. Charging.
Stay clear of patient.
Stay clear from the patient.
Deliver shock now.
Now,
press the orange button now.
Now deliver the shock and we have to press this orange button.
Shock delivered. Begin CPR.
Now shock is delivered and we can begin with the CPR. So this was the functioning of the AED machine. So this is how the AED machine works. So in case if pediatric is maybe having a perspiration in the chest area, so what we can do, we can wipe the perspiration with the help of the white cloth, and then we can apply the AED pads. Suppose if there is a drowning case, so in case of the drowning, suppose if pediatric may have a water over the chest area, so what we have to do, wipe the body of the pediatric first and then we can apply the AED pads. So these are the certain recommendations which we have to follow before the application of the AED pads. So I hope you like this video. So till then you can like our channel, subscribe it and hit the bell icon so that you will get the notification of the upcoming videos. Thank you so much.